This is Karen Jaffe, and Karen, I know you're a specialist in IV cases.
Yes, I
as
am.
a certified legal nurse consultant. And so what kinds of issues do you have? What kind of cases?
I find a lot of cases where there's an IV that has failed. A lot of extravasation cases where there's a vesicant involved and there's tissue death, and it requires a lot of extra treatment for the patient, pain and suffering for the patient, and sometimes even death, depending on the drug.
Wow, so you've actually had cases where somebody has died.
Yes, I have.
Okay, so that could be pretty severe. Now, how do you build your case, either plaintiff or defense? I mean, what do you do to prove or disprove that there's an issue?
I think what I do is I really look at the records as a whole. I go through them and try and pick out any other themes that might be there that might have influenced the patient's care, their treatment, see what doctors are involved, figure out who is involved in this case, who helped the patient, who definitely did not help the patient. And then I start to get into the nitty-gritty of the details. Was it the drug that caused the problem? Was there some sort of issue where the patient had a bad outcome specifically because of certain medication was either given or not given?
Are there any other tips that you have for people working on IV therapy cases?
Yes, know the IV device. A lot of times it's not taken into consideration because people think a PICC line is a PICC line, an arrow catheter is an arrow catheter, but each different line and each different manufacturer has specific recommendations on how to treat that line, how to troubleshoot that line, and what to do with it if something goes wrong, when to pull it.
Okay, so I think you're also bringing up a good point, because I know this is your specialty, and so often, especially for IV therapy issues, we think, okay, any nurse can handle these cases, but you're pointing out that depending on the situation, it might be good to call in a specialist like yourself.
Yes. And I think that the reason I would suggest that is probably because we have been in the trenches troubleshooting these devices. So if something goes wrong and we're trying to figure out how to fix it, we first have to determine what is wrong. Is it just a positional line where you can't get a blood return because somebody doesn't have the right head turn or isn't taking a deep breath in? Or is it really a fractured line or a non-functional line that could actually cause harm to the patient?
All right, great. Well, thank you for those tips today.
Thank you.